So let me watch the number go up and then we'll get started. Oh, it's
Hold on. It said continue. Can you see my screen?
Yeah, you're good. We're just letting everyone sign on. Yeah, they're getting signed on and then we'll get started. So
Perfect. Thanks, Kay.
So welcome everyone. I hope everyone had an awesome Wednesday. I know I did so far this week. I think the rain's finally stopping in Texas. So thank goodness we've had enough of that, really. So welcome everyone and good afternoon and welcome to your Benco webinar. Gateway 2021, Crossing the Bridge into Dentistry. My name is Kay Huff and I will be your Benco host for this afternoon. Before we get started, we want to go over a few housekeeping rules, some CE guidelines. First of all, hopefully everyone signed up for the webinar in their legal name. And what I mean by that is a name that's on your license if you want to receive CEs. Also, each person that wants to receive CEs must also log on to their own device. That way we can actually see that you're on and you need to stay on for the entire webinar. If for some reason you are calling in on your cell phone, that is fine. The only problem is that all we can see is your telephone number. So all I'm going to ask you to do is to please send me your name, your telephone number, and the title of today's course to practicecoaching@benco.com. Again, that's practicecoaching@benco.com. Now that's only if you're dialing in on your phone. If you're pushing the button and you're seeing it, that's perfectly fine. That's only if you're listening on your telephone. Also, when you receive your CEs, everyone will also receive a survey. We ask that you please fill out the survey and give us some input on what you would like to see moving forward, because that means a lot to us. Also, on the very bottom of your screen, you're going to see a Q&A. We ask that you please enter in your questions throughout the webinar. And then at the end of the webinar, Jill will actually go back and we will answer those questions live. Everyone attending will receive a copy of the live Q&A. So that way you'll have those notes to go back home to and look at. So with that being said, let's get started. I am honored to welcome an amazing leader, one of the managing directors at Benco Dental, Chuck Cohen.
Thank you, Kay. Welcome, everybody. We're glad you're here. We've got a great program this evening. We have Jill Obrochta. She is a seasoned registered hygienist and is considered one of the country's top dental OSHA and HIPPA experts. She will help all of us get into compliance, especially around the new COVID regulations. Jill has been teaching, researching, and developing OSHA, HIPAA, and other compliance solutions since 1989. We won't ask her age, but we'll just tell you she's experienced. She has most recently gained dental industry attention and praise for her comprehensive, streamlined approach for implementing COVID management protocols within the dental setting. She is an internationally published writer and educator for several top industry manufacturers, including Waterpik, 3M Espy, and Procter & Gamble. She's the founder of DentalEnhancements.com, her own nationwide web-based education company specializing in OSHA and HIPAA training, and she makes everything easy. She's dedicated to helping dental professionals like you enjoy and excel at the art of dentistry. And her enthusiasm is contagious, but you don't need to listen to me about that. You're going to see that this evening. Here today on behalf of Benco, discussing conquering OSHA, HIPAA, and COVID management successfully and how to bulletproof your dental practice. Please welcome Jill Obrochta.
Thank you. Thanks, Chuck. Thanks, Kay. I'm super happy to be here with you this evening. Yes, that was a really nice introduction. Hopefully what we discussed this evening will help you to optimize your OSHA approach, and hopefully I'll be your HIPAA hero as well. I want to start out by saying I'm a hygienist. So I'm a dental professional just like you. And many years ago, right around 1989, I was practicing in Fort Lauderdale, Florida. I was working as a hygienist and also running a study club for about 30 dental offices. I was doing the OSHA for the study club. Right around that time, you may notice I fell into OSHA compliance by accident. I was about 10 miles practicing from the dentist who had the AIDS virus. You remember he was presumed to be opening his bloodstream during dental injections. Consequently, 9 of his patients come ill with the AIDS virus. It was such a delicate time in dentistry, super fragile in South Florida. I had the good fortune to meet Dr. John Molinari. Many of you may know him as the godfather of infection control. You may have attended Dr. Molinari's course, boot camp for infection control. And so I'm so happy to have called him upon him at that time and learned about OSHA in detail, bloodborne pathogens. That was kind of the start of when we had to truly be wearing PPE. So please know that I'm just so passionate and dedicated about infection control, bloodborne pathogens, and now with these new COVID standards. I do have a company that mentors compliance professionals throughout the country. And we always use Zoom rooms. So this is very comfortable for me to be talking to you through technology. And if you need us as a resource after the webinar, after we close the course, I will provide some Q&A as well. So today's purpose, we're really going to look at OSHA and HIPAA requirements and look at how they've updated and how they're still evolving, right? We're moving through COVID. We could be moving through a variant of COVID. So we want to really understand how this change and these changes over the next several weeks and months will work. We'll discover the 3 must-haves to bulletproof your dental office, especially during dental inspections. And we'll learn what to do right now so that you can bulletproof and safeguard your practice. Now, I'll close the course. I don't want to leave you hanging. Don't you always want to know what to do to make sure that you have solid solutions in your office? So once I close the course, please stick around, ask some questions, and we'll talk about solutions after we close the course. We're open. We've been open for business, thank goodness, right? The last several months have been interesting, maybe a little overwhelming, but we're back. So OSHA, CDC, the ADA did a great job at providing us what we need with new PPE, patient screenings, and infection control. Many offices didn't realize, whoops, we have to have COVID management training before we come back to work for quarantine. And think about all those changes. Everything as far as your paperwork changed. So everything needs to be updated. Your OSHA manual, HIPAA manual, all of your employee forms. There are many reports and assessments that are the first thing that OSHA and health department inspectors will look for. So it makes you kind of wonder, what's the focus? Well, tonight we'll focus on that. 15 months ago, aerosols weren't a problem, right? But now there's bioaerosols. That's the enemy. We need to protect ourselves and our patients from bioaerosols. Every week, my team and I get questions, new questions. Are we really ready? Everything's changing and shifting and morphing. PPE, new infection control, COVID documents, and vaccinations. So I thought I'd start this evening out by giving you a few gems. Isn't it great when you can leave a webinar and have some real powerful treasures to take back into your practice? So let's start by talking about the vaccination. So recently in May, the EEOC said that yes, employers can require the COVID vaccine. You want to abide by the American Disabilities Act and Civil Rights Act. So there are several exceptions that can exempt an employee from needing the vaccine. Make sure that you work with HR or a resource so that you understand. Some of those exceptions could be pregnancy, if someone has autoimmune, or if they have religious beliefs, right? So what do? The best thing to do, be mindful, create a harmonious plan with your team, create a written COVID vaccination policy, voluntary or mandatory. I see that hospital-based dental settings or government-based dental settings have mandatory policies. For private practice, a voluntary policy is great. Make sure it includes everything you need to recognize American Disabilities and Civil Rights Act And just make sure you're deflecting those liabilities, encouraging the vaccine, but create your policy as an asset. Best thing to do is review it with your team, read it over, make sure no one has any questions, there's clarity, and everyone understands that it's across the board for everyone, and then have your employees sign that. Keep that on file. Next gem, infection control to the new COVID standards. So make sure to presently be following state, CDC, and OSHA COVID standards. Early on, OSHA gave us a template. You can Google search this template. It's called OSHA's 3990. It's a template for you to create your own pandemic preparedness plan. The standards, all of the standards, I'll go into that in a bit more detail on the next slide, but definitely you'll want to Google search OSHA's 3990. It's so helpful. Now, back before COVID, all of the dental standards for infection control changed. Yes, back in 2016, another great Google search. This is the summary of infection prevention for dental practices. It's a 44-page document, and this will go over all of the updates to infection control. There's actually 14 new protocols that you should already have implemented in your office. These are considered basic expectations for safe care. So when inspectors come into your office, whether they're OSHA or health department inspectors, they're going to check these new 14 updated standards. They're considered the bare minimum standard by which OSHA and health department inspectors can levy fines. What's changed? Definitely water testing. So the water that comes from your dental chair unit must be drinkable, and you need to prove that by testing, shocking the water lines, and then documenting on a regular basis that your chairs are all fulfilling that protocol. The best way to do that is to get with your Benco representative. They can talk to you about water testing and documentation. Make sure that you're documenting that for every one of your chairs. Regular basis. What's a regular basis? Could be weekly, monthly, or quarterly, depending on the type of water supply system that you have. Handpiece sterilization. Another one of these updated protocols states that handpieces, turbine, and low-speed motors, you know, the ones that hygienists use most often, they all have to go through heat after every use. Another stricter update is the 6 steps that we must take near the sterilizer. So to ensure that every single load is now meeting a hospital grade level of sterilization. It's always great to have one primary sterilizer and a backup sterilizer as well. So this is a little bit about the updates for infection control. If you don't quite know about the summary of infection prevention for the dental practice setting, make sure to Google search and get this PDF, study it, and make sure it's all implemented. New written COVID protocols. So COVID documents all update. Definitely your OSHA manual, your HIPAA manual, and your employee forms should be updated. Now remember, early on, OSHA gave us a template, 3990, that will go over, and you could create your own workplace template for COVID written protocols. Recently, the ADA did make an announcement that you need to have a hazard assessment as well. So as things change and as we go through COVID and maybe variants to COVID, we have to keep assessing and updating our COVID protocols. To create your own written, customized pandemic preparedness protocols, you can use the template, OSHA's 3990. There are 6 sections, and they're laid out so that you'll have to answer 56 protocols. Now, it's not completely an easy task, but health department and OSHA inspectors are going to ask for this document straight away when they visit your office. Within 5 minutes, they'll definitely want this document. If you create your own COVID preparedness plan, it will take somewhere between 50 and 100 hours. Many coaches and resources that teach OSHA have templates. I think the template is the easiest way to go. I love templates because you can actually read the template, start getting and gaining an understanding of what needs to be set up, and then you can just check off and fill in and customize the template for yourself. Please be aware that a COVID document is definitely necessary. These last couple of weeks, I've had a lot of calls about the recent announcement from the ADA, where dental practices are said to be largely exempt from OSHA's new updated emergency temporary standard. What does that mean? Well, let's take a look. Let's look at the key takeaway points. In dentistry, we're largely exempt. However, you can only be exempt if you continue to follow these key provisions. So pre-appointment screenings still necessary. Everyone must be screened prior to entry. That means patients, employees, and non-employees on site. Those with suspected or confirmed COVID aren't permitted to come in. Now, you could ask your employees to self-screen, but always document, even if it's a checklist, even if you're checking things off and dating. Remember, the first thing inspectors look for is your documentation. So it's smart when you're screening to document. Dental practices must also have that written COVID plan. Make sure it includes hazard assessments to identify potential workplace hazards as they relate to COVID. And a hazard assessment may have to be updated. Again, with a hazard assessment, I love a template. That should be included inside of any COVID work written plan. And pay attention to your state OSHA, other local regulatory bodies, because they may enact more stringent standard. And that could include for your state one that covers dental offices. So those are key takeaways. If you're looking to understand the ADA's recent announcement about the emergency temporary standard, this will give you 4 great bullet points to follow. Now, I have dental teams ask me all the time, can't we go back to the way it was? Well, it would be great if there was a way that we can get back to pre-COVID standards. But what I'll say, the big takeaway here is please be prudent. You've probably done so much to set up COVID management standards within your office. Keep them in place. Right now, it's best practices to keep things in place. Pay attention to the updates and always make sure that you're paying attention to your state protocols because there'll be plenty more to come. Now, one more really big statement that I want to make is with regards to OSHA's general duty clause. So this applies to every business in the USA. Employers must provide for each of their workers a place of employment which is free from recognized hazards and likely to cause death or serious harm. We're moving through COVID. There are variants that we have to watch. So the best advice, be prudent, be safe, make sure you're following COVID standards as they're changing, right? That could be week to week, that could be month to month. So more to come as we move forward. What's the result of not being OSHA or HIPAA compliant? Definitely fines, loss of license, loss of trust from employees or patients, right? And it's so hard to retrofit a plan. Once you have an OSHA inspector or health department inspector, when the inspection and audit is in play, it's always more nerve-wracking to retrofit something. I want to point out this year in 2021, one serious OSHA violation merits over a $13,000 fine for one serious violation. And if you don't willfully correct and rectify that violation, it doesn't double, it goes up tenfold. So much better to be proactive. You're here tonight, you're learning, you're getting enlightened, hopefully you're getting inspired. So it's a great way to avoid all of that. If people ask what's the most important thing to update for COVID, this is what I say. When it comes to OSHA and HIPAA, take all of your liabilities, make sure that you change them into assets. Once that's an asset for your office, you can showcase your infection control, you can showcase your COVID management program. So OSHA requirements and HIPAA mandates, make sure they're rock solid, and make sure your team is holding up their end. It's as simple as connecting the dots, right? Using checklists, using reports, keeping up on different governmental websites. So checking out OSHA, I always like to Google search OSHA COVID dental, right? And that always brings up the most recent update. Same with CDC. Now, CDC's is a little convoluted. So we like to have a toolkit or a place on our website that is a reference for dental professionals. You may want to check that if you don't like searching around and getting lost on some of the government websites. Connect all the dots to make sure that you're optimizing all of this for your office. Let's talk a little bit about what is truly required when it comes to OSHA and HIPAA and these COVID updates, just so you don't have to suffer an insidious inspection. So if you've heard me speak before, you've heard me say this a lot. Build it all. Build comprehensive programs. You may want to take a picture of this slide once I have it up. So first thing, employee training. Employee training now applies to all employees, full-time, part-time, clinical, and non-clinical. So you have your basic OSHA annual update. That would include anything from fire safety to bloodborne pathogens. A second module that must be included that inspectors will look for proof of training is in COVID management, infection control, a third module, because remember in 2016, CDC and OSHA created that summary of infection prevention for dental offices. Many state dental boards require an infection control module be submitted to get your license renewal. And then chemical safety. That same year in 2016, the USA joined 63 other countries for an international chemical safety program called Global Harmonization System. And it updates your safety data sheets and explains some manufacturer labeling system. So if you have employees, each employer should have a uniform COVID or a global harmonization system update for your office. Now, it's only required once in a lifetime, but please make sure you have that implemented at your office. So you can see there are 4 modules for OSHA that inspectors will look that all employees have been trained in. And then HIPAA rules. HIPAA all changed back in 2013. For HIPAA, the protocol is this for training. You should be training all of your employees whenever you have technology updates. So if your software updates or changes, or if you have new computers, right, you add new encryption programs to your office, or if you have a breach, hopefully none of that, at least once a year on a HIPAA update training with proof of training. So there's actually 5 training modules, right? Documents. I can't enforce enough. The first thing an OSHA or health department inspector are going to look for are your COVID update. In terms of your OSHA manual, all employee forms should be updated to the new COVID standards. That includes vaccination forms, right? Checklists, safety data sheets. Same for HIPAA. HIPAA manuals update to a COVID standard for privacy. And once a year, you should be completing a thorough risk assessment of everything that deals with HIPAA in your office. So all of that for documents. And finally, there are facility requirements. When you combine what you learn in your training with all of the documents, that adds up to be about 100 OSHA protocols, and there's about 60 more protocols to implement for HIPAA within your office. So what are those 3 must-haves that inspectors are going to expect from your dental team? Here they are. All employees should be trained in those 5 modules. Produce current documents, manuals, forms, all to COVID standards. Make sure you have a vaccination policy that's written and a pandemic preparedness plan. Finally, all facility protocols. Remember, there's about 150 to 200 protocols. They should be updated and functioning in your office already. This is a day in the life of an OSHA trainer. For me, this is my wheelhouse. It's not that big of a deal. 5 modules, 1,000 documents, 200 protocols. But for the average practice owner, office manager, or someone who has to manage the OSHA and HIPAA programs in an office, it can be overwhelming. So you're here tonight, you're learning about OSHA and HIPAA and the requirements. Just please align with a resource that can help you to stop the overwhelm or do your research. I've seen that private practices now are assigning one person. That person coming back to work after COVID may put in 15 to 20 hours a week with keeping up on these protocols. I also see that group practices have a person in charge of compliance, and they may be going to several different locations. It's important to note that if you do get a visit from an OSHA or health department inspector, many times they visit all of the locations in the group. So making sure that you have one person at the helm to manage your OSHA and HIPAA compliance programs is important. And hopefully tonight you're taking away some of these gems, these treasures, so you can be super powered. Remember, when I close the class, I won't leave you hanging. I'll definitely give you more inspiration when we do the Q&A, and we'll talk about solutions. Now let's talk about solutions, right? Updating your OSHA, HIPAA, and COVID program. When this all first started last March, I thought, wow, I have some work to do, right? We're going to be rewriting the books and the forms and everything with regards to how we practice dentistry. We're in a new era of practice, right? So I knew we had to do this really smartly. When you rewrite your programs, make sure you have your manuals, employee forms, and reports updated all to the COVID standard. Give the inspectors what they want. As soon as they get to your office, within 5 minutes, they want all of that documentation. Make sure it's updated and at your fingertips. If you have someone that's in office, make sure they're proficient at updating your program. Make sure that person is reliable, that they love studying data, they love compliance, or get guided help from an expert. I like when things are attainable, don't you? So using checklists and having someone, a resource that can mentor you through and answer questions if you're using checklists or step-by-step directions to get clarity so that you implement things the right way. And depend on the authorities. Please look to the CDC, OSHA, federal websites, definitely your state governors and dental boards. These are authorities that you should look to often. To implement everything, it should be attainable. So making sure that it's convenient and sensible and easy enough to implement, because you still have to focus on dentistry, right? So a smart program is very important. The perfect solution should be comprehensive and accurate to include your training, all of the documents, facility protocols, and if you can get mentoring, that's going to be even better. Keep up with things as they change. Now, before COVID, you sort of could implement things a la carte. Maybe once a year you do training and have a facility checklist, right? But not every year were you updating documents, and certainly not manuals. But through COVID, now everything changes. Everything needs to be updated. Very important takeaway for tonight. Make sure you update everything, your training, your facility checklists, new documents, and manuals. Getting mentored in this would be a good idea. Another thing that comes to mind as I work with clients, patients are really concerned with COVID. They want to know if you've updated your infection control. So very important to keep your focus on patients and infection control. They want to know, did you do COVID training? Is everything up to date? Is your infection control up to date? So share your enthusiasm. It's a great idea to showcase your infection control efforts. Hey, if you have to go through all this learning, it makes it so much easier if you can all get excited as a team and then showcase your efforts. I like to put decals on entry doors, windows, and even your partitions, your plexiglass partitions, or have a wall certificate. And I really love that lately I see dental teams showcasing their sterilization center, putting up something simple like a glass wall with something decorative. As your hygienists and dental assistants walk in patients, it's a great idea to have a conversation about infection control updates and what you've done to manage COVID within your facility. It definitely is a win, and it's a practice growth solution. When was the last time you've updated your OSHA and HIPAA program? Definitely make sure when you leave this evening, going back into your practice, that you look at employee training, 5 modules, all of those documents, manuals, forms, and reports, and then your facility protocols, about 160 protocols. Make sure they're all up to the full COVID standard. Well, Kay, that was a lot for me to go through in a little bit of time, but I want to say that I hope that everyone attending tonight got some good insight, can take away some treasures, some gems, just making sure that you're looking at your training, looking at your documents, and also looking at the protocols. That's key. Those inspectors are going to come in and they will want to look at the documentation first. If it's all up to snuff, you should be in pretty good shape within about 30 minutes. But if not, they'll definitely hang out at your office. We don't want that. So with that, I want to close the session, and I will keep my email up. If any of you want to email me additional questions or have me as a resource, I definitely will welcome that. I will close the CE portion of this evening. Now, we still have a little bit of goodness in store for you. So right now I'm going to take some questions, and then we'll talk about some solutions. So keep hanging out. If you can, stay with us. I'm going to look at some of the Q&A.
Yeah, we have 4
Kay, you're
questions
back.
there.
Excellent.
Yeah,
Okay.
you can hear me good. We have 4 questions there. So guys,
Mhm.
please make sure now's a great time to enter the questions. Can you see them, Jill? Do you want me to go with
Yeah,
them?
I can. So
Okay.
one is about HIPAA, and it's about safeguarding your computers so that your employees don't, use computers or FaceTime while they are on the clock. Explain the FaceTime and HIPAA violation. So, I think that's an internal policy, but certainly, I believe that you can make policies, and this is more of an HR question more
It
than
is.
a HIPAA question, but just having policies and making sure that you have a trusted resource for HR. Kay, that's almost your wheelhouse for HR, right?
Yeah,
And just not allowing cell phones in the back. What do you think on that, Kay? I just think
yeah.
that cell phones aren't really a good thing to have in the back when you're looking and caring for patients. Your take on that one, Kay?
You're absolutely right. And this is what we'll do is that you can actually send us an email and we'll get you in touch with Tim Twig. Tim Twig is our partner. He'll
Yes.
really be able to give you some really good guidelines on that because it needs to be a part of your HR manual. And then it needs to be the one thing that you have to do is you have to make sure that the policy is for everyone, not just some people, but everyone has to follow the same policy. So we'll definitely, Deborah, we'll definitely give you some information on that. Okay.
Perfect. And then Kay, the next one is how long do we need to keep our documentation of pre-screening? I love this one. OSHA documents are 3 years. That's a lot of paper, right? 3 years until further notice. Now, remember, we want to keep watching what OSHA says, the CDC, OSHA, and your state boards or your state authorities. So right now, 3 years for OSHA documentation, and I believe COVID management is falling under the OSHA guidelines.
So that is
Next,
for the pre-screening, is that correct?
yes,
That's for all those
for
pre-screening
pre-screening.
questions. And that's on employees too, correct?
That's for
Jill?
employees too. Now, I know with the new ADA announcement, for clarification, an employer should be screening. You can ask the employee to self-screen, take their temperature, take all of their symptoms, right? I would definitely have something, a check mark some dates and some sign-offs. So you can condense your forms and make them maybe into a table, but remember, those inspectors want documentation. I know it is a little bit of trouble, but whew, it's so great when you hand those documents over and you know that all that work goes to good use, right? Next one. Do you have handouts for this that we can download? We don't have a handout, but Kay, is this going to be able to have rebroadcast?
Yes, we will be able to actually, you're going to be able to see this later. And then Jill, if there's anything that you want to send out, like a handout of how to get in touch with them, when we send out their CE, we can also send out that, if you have anything you'd like to send.
Cool. Now, I hope I understand this next question correctly. I did make some recommendations for Google searches, right? One is OSHA's 3990. That's the document, the template. So there's 6 sections to write your own COVID preparedness plan, 56 different checkpoints. It does take a good amount of time. So if you need a template is also a good idea too, if you don't have the wherewithal to stick with that. So will you cover everything needed for OSHA and infection control? Will the Form 3990 cover everything needed for OSHA and infection control? It covers everything needed for a COVID written plan. It goes into even more than just OSHA and infection control. It goes into furloughs and what to do in quarantine and how to order supplies, how to make sure that you don't run out, like just a lot more things. So if there ever was another pandemic, we refer to your pandemic preparedness plan, God forbid, but that's what the government wants us to do, to have more preparedness next time. And then, do we need to use a form for patient screening? I would say yes. Remember, document, document, document. The inspectors want documentation and proof. So until further notice, I'm going to say that one is a yes. And finally, Kay, employee screenings. How can we update this? Employee screenings, well, we were doing employee screenings as we came back to work from COVID. So I know the ADA has a form. If you're a member of ADA, we have a form. And so I would just sort of use your resources and make sure you definitely have an employee screening form. They're getting to be more like a table so that they can be more condensed so you don't have mountains of paper. Okay, a couple more questions. And how are we doing on time? Okay, pretty good?
We have at least 15 more minutes of the CE.
Okay, perfect.
So this
All right.
is actually going to cover some of that. So I want to make sure we answer all the questions. So guys, please sending in your questions. We really appreciate that.
Putting in your questions. Employee screenings. I am on, can patient documents be kept in EHR? Can patient documents be kept in EHR? EHR.
What is EHR?
I don't know what EHR would be. Emergency health record, employee health record, employee health record. Woo!
Yay, good for
can
you.
patient documents? Not a patient document. Well, I guess I'm going to say like what if you have a medical history of an employee? If your patient is an employee of the practice, then I guess you're storing an employee record there. But I definitely would, if you're asking something like that, medical histories are typically just stored inside of your software. And OSHA inspectors know that if you're utilizing medical histories, that they're going to be in your software, they're a patient of the practice. For COVID vaccination cards, I would keep those private in an employee file.
On this other one, this is electronic health records, I think.
Oh, on electronic health records, patient documents, electronic health records, patient, that's your HIPAA, right? So electronic health records, patient documents, that falls into your EagleSoft and your different softwares, right? EagleSoft and Dentrix, right? So those are electronic health records. If you're more specific with that question, I'll go into more detail, right? So there's a comment about Michigan. As I said, follow your state I would look at your state governor's offices. So many states are saying, hey, some people are vaccinated, some aren't. So to safeguard everyone, many states are keeping mask mandates, and they want people to wear masks. But your state will definitely give you the guidance. So I think that question from Michigan was answered.
Okay.
And if we document so many are coming, if we document a patient's chart, is it sufficient that we don't need to keep the documentation, paper documentation? So if you are documenting that you have been taking the screenings electronically and it's clear and concise with the date and what you documented, yes, in electronic format, they're saved. So save a tree, right? Save paper, absolutely.
And a lot of our offices are doing that. I mean, it's even a recommendation to use it as an electronic form. You send it to me when you walk in the front door. So that's a good question.
Great question about employees being vaccinated. So many people think you don't have to screen them anymore. But remember, we're getting exposed. We don't know enough about this particular pandemic. So check with your state to see what the guidelines are. So what the ADA recently put out was that you must still pre-screen, right? Patients, employees, and non-employees that are coming into the practice if you want to be exempt from all of the other things that are in that emergency temporary standard. So definitely.
So again, the question is that if your employee is vaccinated, because I don't know if we read that out loud, if the employee is vaccinated, do we still have to do pre-screening? And your answer was yes.
Yeah, until further notice or until your state would say otherwise. What staff immunization records need to be collected with COVID? Is it legally accepted to provide immunization records for that, or do they need to sign a refusal to be vaccinated, a form similar to HEPA? Well, I would say that management does have the obligation to keep these vaccination cards and records confidential. So I know I get questions sometimes, like patients call and they say, are all of your employees vaccinated, right? So the right answer for this is a great takeaway. The right answer is that management must say that we are very careful to ensure that we're doing COVID management training and a COVID management program, which includes our vaccination protocol. And we're also abiding by confidentiality rules so that we keep those type of documents confidential, right? And employees can tell each other if they're vaccinated. Employees can choose to tell patients, but management cannot. So I hope that answers that question. That's a good one. I like that.
I think that's really important, Jill. I think that that's going to be a lot of people want to know that, because we have to turn in our HIPAA. We do HIPAA. That was like a big thing that we actually turned it, and the office paid for it. So
yeah. So it's, you don't know where the lines blur, right? There's OSHA, there's HIPAA. That's why it's so nice to be able to have a resource you have to kind of bounce these questions. They're like, you never thought you'd use those story problems when you're in grade school. And here we are, we're using real life story problems, but it's important stuff, right? We have a questionnaire in Dentrix that we use for COVID screenings. Will that work for documentation? Electronic health records, they're stored, they're safe, you can store them. So screening, as long as you're documenting, and you document electronically. So that's perfect. What questions are best to ask at a pre-screening? I would definitely utilize something like the ADA toolkit or use a template from a resource. Like we have templates as well, but there's too many that we would have to go through that right now. I think it's better to just really look to your professional associations. I have seen some on the CDC. They're a little bit harder to find. So if you're a member of American Dental Association, theirs is great. Same thing with their employee screening form, I like. And I see that many offices are condensing and making it into a table. All right. So, Kay,
I have a few more. I think there's a few more that we need to do. Yeah. So,
okay.
I also want to ask you a couple myself. So what about magazines and things like that in the waiting room? When can they start bringing that sort of things start out? Like, water, opening up their waiting rooms. What's some of the guidelines for that?
Not yet. I would definitely still, 6 feet apart. Make sure you have minimal inside of your reception room because we have a variant coming along. We don't want to have to go backwards and forwards. And I think, remember, keeping everything that's an asset as an asset as much as you can. You did so much work to come back to work after the COVID quarantine. So I would still keep things at a minimum. And, food, drink, I get that a lot. Like we used to have a coffee bar or serve water. I would say let someone take something like that when they're leaving, but definitely having it inside of your reception room and then bringing into the operatories. Oh my goodness, that would create some liability. So I would definitely refrain from too much of that, too much stuff that we can touch, right? What else do you think, Kay? Hit
And
me.
so what about, tell me some of the furniture, like I noticed some of the people were changing out their furniture and going to more of something that's wipeable. Is there guidelines and recommendations on that for the practices?
I think the great thing about OSHA's template 3990 is it gives you some smart guidance on that. But doesn't it make more sense that if something's material, it's going to be more absorptive, like a fabric, as opposed to something that's vinyl that can be wiped down? So the more that you can stay infection control conscious and then just really be able to disinfect, I think the better. It's smart. I had the opportunity to work with Benco's design team, and boy, did we have a lot of really great, it was like a think tank. We were thinking about not only the furniture, but how to set up privacy panels, and then like those really great walls that feature the sterilization center. So just using all of these updates to showcase your practice and be smart. Just show that off to your patients, because I think it really makes a difference and an impact. They have peace of mind when they know you're going the extra mile, right? I know there's limits, but just be smart at what you're going to pick and choose. When you look at OSHA's 3990 or create a written plan with someone, you go through a lot of this, right? It's customized for your office and your what your dental specialty is, sometimes even your state.
And another thing too is that what about the shields? I know a lot of offices that I've just recently gone into, they've been co-traveling quite a bit. They're starting to take down the shields, but as long as they're wearing the mask, do we still need to have the shields at our front desk?
It's important that you do a hazard assessment or a risk assessment. So if you're going to change something out and take away, I would say that you should do a risk assessment, a hazard assessment. That means looking at your community, looking at your state, looking at COVID at large, and then you have to really discern and explain why you're making those kinds of moves. But keeping masks on for those people who may or may not be vaccinated. We're just moving through this. So moving through slowly, keeping everything as an asset instead of a liability, I think is always the prudent and safe move. Definitely.
And so what about the face shields versus the mask at the front desk? Like, a lot of them are wearing the face shields because they want the patients to be able to see them. What's your thoughts on that?
Masks are things that are just so common. I think if you wear both, it's great. I have seen offices switch out from one or the other. I would definitely look to your state and make sure that you're analyzing the PPE for your administrative team. So if someone is at the front desk, like working either with patients or employees, I would check your state protocol to see if you can use one or the other. Or I've just seen mostly that the surgical masks are favored, or both.
Or both, right?
Oh, but it gets so
I
hot, right? It gets too much to wear, but we have to do what we can tolerate, what's safe, right? Do the right thing for
So I
now.
would like to jump back in and I know someone's wanting to see the screen that you asked them to take a picture of the recommendations. Could you pull that back up for me, please?
The recommendations, which one?
Said, would you be so kind to pull up the screen that you recommended that we take a picture of? So you recommended they take a picture of a screen, and I don't remember exactly which one it was.
Oh, I know it was, and I don't know if I'm going to be
yeah, you can just go
talented enough.
backwards on your just take your PowerPoint and move it backwards.
Okay.
And
All
then
right,
I also
sure.
wanted you to go a little bit deeper into the water, because that is something that, you know, is new with us. So tell us a little
Yeah.
bit more about that, if you don't mind.
Okay. So I'm having a little trouble getting out of my PowerPoint. Here we
There
go.
you go. You got it.
All right,
And then just
cool.
go right back
So
into
let
it.
me put this slide up. Yeah, and then we'll talk about water a little bit. So please definitely talk to your Benco representatives, right? So your Benco representatives will know so much about water testing, water shocking, and then the documentation. There are kits that you should get. And the kits can either be purchased as single, 6-packs, 12-packs. So depending on how many chairs you have in your office, and depending on if you have a water reservoir, if you have straight water lines from the city, or if you have filtration. So I would definitely talk to your Benco rep. They'll be able to look at the equipment and the setup that you have, how your water is plumbed to each chair. And so what happened really was several years ago, first it happened out in California, this incident repeated itself in Atlanta, in Washington. People were getting sick if they had deeper dental procedures done from water lines that weren't regularly cleaned. So, you know, biofilm grows in those tubes. Most of the time it's dark and it's stagnant in there. So it sloughs off some of that biofilm. If the biofilm goes into a deeper dental procedure, root canal, pulpotomy, root planing, surgical extraction, if those water lines aren't cleaned on a regular basis, then people were having issues, people that were immunocompromised, children, the elderly. So for several years now, dental offices, this is part of that summary of infection prevention, right? That 44-page document to look up. You must regularly document that every one of your dental chairs has drinkable water. And so talk to your Benco representatives. They'll get you set up. They'll teach you what to do for each chairs for the specific water line. That's what they're there for, right? They have all that knowledge, and they're happy to help on that. So I can help to make sure that you understand the laws, and then your Benco representative can help you to make sure that it gets into a really good place. Good. All right. Anything else, Kay?
And that has to be documented correctly. That has to be documented and kept. That documentation has to be kept.
Yes, it definitely has to be documented and kept for every single chair. Now, if you have a reservoir system, the regular testing, shocking, and documentation should be 90 days. If you have straight city water, sometimes it's as often as weekly. I think it's always better to convert to the water reservoir. Makes your life a lot easier. There are products that your Benco representative can tell you about that are, it does the shocking and the daily purification in one step. They'll teach you how to fill out usually the document, the log comes with the product or the system that you're ordering. So there's a lot to it, right? But definitely inspectors are going to look for that, especially if you're a pedo office or an ortho. Definitely they're looking that those water lines are clean, because a lot of these instances happened with children.
I've heard of that. And then really quickly, there's a couple more questions. And then this one is that they have their questionnaire in Dentrix, and they want to know, do they still have to write it in screening? So I've always heard that the code that lives on paper for up to 6 days. So you want to get rid of paper in your practice completely. So, you know, if you need some help with that, let us know at Benco. We'll help you. But is that, so Jill, can you just go a little bit on that? Why is it that we need to get rid of not just some paper, but all paper?
Well, you know, I think we're going to eventually here in a couple of years be going the route that medical did, right? So completely paperless. It's not quite required yet in dentistry, but eventually it will. That's it. It's an infection control issue, isn't it? The more you touch, the more that sticks, and we can't really do anything with paper. So adding a touchpad talking to your Benco representative about adding those touch pads, making sure your forms can go into Dentrix and be converted so that it's just quicker, easier. I think it's just easier on the admin team as well, but it becomes an infection control issue. So through your software, the software updates through Benco, you'll definitely be able to utilize forms that are just easier to navigate, right?
Yeah, absolutely. And then a couple of more questions that I want to ask you, but let me see. There's a few more on your screen. Do you see them?
Let
Just go to
me
this one.
see.
So I was going to ask you about the doctor being able to go in and check hygiene patients. At one point, we were told they had to finish the procedure before they left the chair, or because they definitely don't want to take the gowns on and off. What is there any new protocols on that?
Can you just repeat one more time, Kate, for more clarity for me?
So if a
Protocols.
doctor is in the middle of a procedure, do they need to complete the procedure before they go to the next patient?
Well, you know, I'm not sure that they need to complete the procedure, but if they're in an aerosol procedure, and they have a lab coat, and then they're going to check a hygiene patient, yeah,
They're going
that.
to have to take it off and take it back on before they come in the room. So
For
at
sure.
one point, they said they needed to complete the procedure before they left. And then
Mhm.
honestly, that slowed the doctor's office down. I mean,
Right,
like,
right. I think that most offices are figuring out how to kind of maneuver through. Now, definitely you need a different lab coat if you're in an aerosol procedure, right? The aerosol, all that PPE, you have to make sure that it's not walking out of the room for sure, right? And then if there's hygiene checks, I mean, lab coats, disposable lab coats. So many offices are putting stackable washer and dryers and doing the laundry there. It's just like if you're at home and you're doing a ton of laundry, right? You're just constantly cycling through the lab coats. So the lab coats are still important. They're a part of PPE that does need to be refreshed during aerosol procedures. That hasn't changed yet either.
and also if a patient is documented that they've had COVID, I mean, or someone in the office, what are some of the guidelines for that?
If it's documented. Oh, so yeah, part of that 3990, when you look at that template or when you get guidance on filling out a template, it would be that you know your triage, right? So if someone's screened or somehow they get back in the office, that's why taking the temperatures outside is always your best bet, right? To be safe. But if perhaps someone has COVID, that's in the office, you have to know how to triage, get that person isolated into another room. And then you'll have to know, depending, were all team members wearing PPE, right? And what kind of exposures there are. Do you have to close down the office? Do you have to do a deep clean? So it becomes situational dependent. But oh my goodness, when you're wearing PPE and still doing social distancing, it makes your practice so much easier because you can still flow and function and carry on knowing that you have these protocols in place. It just makes sense and it's smart, right? Depends on the situation.
Sure. And what about the lunchrooms, team members eating lunches together? What's your protocol on that?
You know, still 6 feet. I know that people were eating in their cars and staying away from each other. So I see teams that are kind of rotating their lunch times, keeping 6 feet away from each other. A lot of teams have gotten picnic tables, and if they can, if the weather permits, they're eating outside on a picnic table. So they're keeping together, right? But they're not keeping that closely together. And again, it's not just if you're vaccinated, you're exposing and exposed to all different people. So it's just being mindful, being safe, and decreasing liability, still 6 feet apart. Mm-hmm.
And then you see that you have 3 more questions here. So I don't know if one of them is what
The pre-screening, I can't really answer that because I'd like you to look at the ADA, right?
okay.
Dentapure is something, I love Dentapure products. And I would definitely talk to your Benco representative about how that fits your equipment, right? And what it does, and if you have to do any extra steps. And then for Ohio, check your state boards. So definitely check, please check with resources to make sure that you're understanding those laws correctly, right? Good. I think we're all set.
Let's see,
on
let me-
questions. Excellent.
Okay.
And Kay, so I have a couple more things to share. I don't want to leave everyone hanging. So we talked so much about everything that we have to do and what's not in place. But I don't want people leaving thinking, oh my gosh, there's OSHA, there's HIPAA, there's COVID requirement. No one's doomed, right? I don't want anyone leaving here overwhelmed or in tears. So we're going to talk a little bit more about some solutions. And definitely, if you go back in the next day or week or month and an inspector comes in, you just want to be proactive and be ready. So now that our course has ended, I want to talk about some solutions and some of the things. I'm so proud of my team and what they can bring to help and be as a resource to any of you that are at the webinar tonight. So remember, this is our wheelhouse. This is just what we do every day. We love this stuff. Most practice owners, office managers, or your the key person who has to implement OSHA or HIPAA doesn't love this. So we want to make sure, I just want to leave you with something that's powerful. So I'm just going to go through something special for everyone attending tonight. Actually, I have two things that are cool. I've just learned over the years, Kay, that really a perfect solution is something that's going to make your experience with implementing OSHA and HIPAA easy. So it's got to be affordable, approachable, easy to understand and implement. We definitely want these COVID updates because that's the first thing the inspector wants. But when you get guided help, it can mitigate your worry, your risk, your overwhelm. Oh, that feels so much better, right? We learned that perfect solutions definitely all inclusive and comprehensive. Please make sure you have this takeaway. All of the training, the 5 different modules for our OSHA, one HIPAA in Texas, you have state HIPAA as well. Documents, manuals, updated employee forms, and definitely a HIPAA risk assessment report annually. And then implement that into those 160 or so protocols. If you get mentoring, I do want to let you know that my team are all former dental professionals. They speak your language. If you're looking for a really comprehensive solution, my team are hygienists and dental assistant turned into experts because they go through some rigorous compliance training. And just talk to your Benco representative. The package that we have right now that I'm going to tell you is special will be those 5 anytime webinar video modules. We send out a big box of manuals, forms. Things are turning into electronic in 2022. And we do provide 2 guided help sessions. So you don't want to go through your manuals and your forms alone. So you do get guided help and we create customized checklists for you. It's a godsend to know that you have a dental assistant, dental hygienist, someone who understands COVID and HIPAA at its core. Whew, it gives a lot of peace of mind. So if you would like to have a private OSHA and HIPAA status review, we're super happy to do that. Just contact your Benco representative. This is our contact phone number. It takes 10 minutes. Isn't it better to know that you're going down the right road or that you have everything than miss something? So please know we're here as a resource for you. And during that 10-minute status review, we'll ask you several questions. If you answer no, chances are that you need to add those things to your current program, right? So if you're thinking from tonight, am I really ready? Just reach out to us, reach out to your Benco representative, and we're happy to help you.
And Jill,
So,
said earlier too that you can just have one dedicated person that then that person can teach the team. Is that correct?
oh no, oh my gosh, I'm so glad that you said that
Yeah.
because the used to be that you could do that, but the worst thing that you can do these days is that inspectors will expect that everyone's gone through these 5 different modules, proof of training. So we don't want to have one person. You want to have uniform training. Right now there's 56 points, learning points in 5 modules. And that does change. So making sure if you have that one person in the office that goes to a course and comes back and tries to reiterate it. Now, I do know that sometimes an office or a group will dedicate someone. And if they're going to go through certain trainings and keep up on it, that's cool. That's good. But we definitely want to make sure that everyone has the same experience, right? With the same exact learning modules. Super important. So you can either designate someone, I would say they would definitely be giving, I don't know, 10, 15 hours. And then I see group practices that have their own compliance agent, which is cool. Or you can work with any of the coaches at Dental Enhancements. We're super happy to help this be really streamlined for you. So, hey, we have a special. If anyone is interested in doing a really super comprehensive program, normally our all-in-one package is priced at $19.98, but we have a special through July 1, 17% off at $16.99. So please talk to your Benco representative. If you want to do that status review, always better to see where you're at first, right? So that's something special for all of our viewers tonight. We have another fun event coming up, don't we, Kay?
Yes, we do.
In August, on Friday, August 6th, save the date, from 1 to 3 p.m. EST. It will be a Wizard of Oz theme. And it will be about inspections and audits and fines. Oh my, we'll dig deeper into what happens when the inspectors come calling so that you're ready. And I'll give you more insights and more answers about what to expect during an OSHA or health department inspection or a HIPAA audit. So I'll get out my ruby glass stilettos and we'll dance down the Yellow Brick Road on August 6th, right?
And this is going to be a 2-hour workshop. So
Mhm.
we'll give you more of information on this, but this is definitely something that you definitely would want to sign up for. So we have limited seating. So please make sure that you, at the end, we'll give you I think it's right there. We'll give you the spot to sign up for this course.
Yeah, you can go to shopbenco.com, look for inspections and audits and fines, or the email, I think, Kay, isn't it practicecoaching@benco.com?
That's correct.
Cool. And so with that, I will say a big thank you to Benco, Chuck Cohen, to Kay Huff, to your team. You are all so fantastic with what you do to support offices. And I want to thank all of our attendees for really investing your time in your evening in learning about OSHA and HIPAA. I know it can be kind of boring. If you need some help, please take advantage of giving us a call over the next couple of days or the next couple of weeks. We're your resource. Really happy to do a status review for you anytime at all. Anytime.
So now, Jill, and one more thing, Jill. So, because we still have like 9 minutes. So just really quickly, all of your material and everything that you do is all electronic. So they don't have to go anywhere. They don't have to fly their team anywhere. Everything is done electronically. Is that correct?
Well, how we do implement our program is that we have all of our learning modules through one link. You have access to all 5 of those learning modules. Now, we will send you a big box of manuals and forms. So inspectors are still a little old-fashioned. I would anticipate in the next 3 years, we're going completely electronic. We're already creating electronic manuals for 2022. This year, you get those binders. Remember, inspectors want the documentation within 5 minutes of coming to the office. If you have some of those screenings inside of your software, don't worry. They understand that you know how to reach those and look at those, but they're really looking for your COVID management, written program, all of the updated forms for your office, the manuals. So you'll have access to our portal that gives you access to all of your videos. We do have a lot of things in electronic format, but we send you the kit and then you have 2 sessions. We usually mentor one person at the office and we'll go through all of that paperwork, which can be really dry and boring. And then we make sure that it's customized to the right standard. It really is helpful to connect the dots with one one of our coaches. So that's that all-in-one program that I was talking about. The all-in-one includes all of the stuff we talked about tonight, and then you get guided help. I think that's the best part, right? You can talk to another dental professional that knows what's an autoclave, what's a burr, what's a handpiece, and then we connect the dots and you're in good shape, right? Ready to be bulletproof for any OSHA inspection, for sure.
And I just want to end it by saying, and this is a requirement. This is not something that we can think about doing. It's something that an office has to do. So if your
Yes.
office hasn't done it, because I get a lot of questions sometimes from team members who go, my office really isn't following it. What do I do? So I think this is great information. If you really want to make sure if your office is not doing it, reach out to Jill. You know, we can make sure that we get you in compliant, because the one thing we want to do is keep you safe.
Keep you safe, keep you, your employees, your patients safe. Definitely. That's the main thing, right?
And so, Jill, this is your telephone number. They can either call you direct, they can email you, and they can also definitely talk to their friendly Benco representative, and they will
Yes.
also be able to get you in touch with each other.
Absolutely. Absolutely. I always welcome anyone who has questions. Please reach out. My team is available to do these private status reviews. I think the best thing is to talk to your Benco representative as well. They have a lot of knowledge about our programs and about a lot of the infection control supplies that are necessary to make this program successful too, because, you know, PPE, the water testing, what happens at your autoclave. So they're a big integral part of helping us to make sure that you have ongoing success.
Yeah, that was really interesting tonight. Like, I mean, there's so much that's changed out there. So I'm going to get Lisa to pull up what our upcoming webinars are. So give me 1 second. I think we have a couple of questions while she's doing that. Let me just see. One of them is the Ohio State Board has not really given them any guidelines. So what's your take on that?
If they haven't updated or changed for Ohio, I would definitely stick with your federal guidance, right? So there's kind of 5 different prongs to the wheel. One is OSHA, one is COVID, one is your governor's office. It would also be health department and your dental board. Always great to check with Ohio Dental Board, the state governor's office, and then look to OSHA and the CDC. If you want some like a condensed area to look things up, on Dental Enhancement's website, dentalenhancements.com, we have a COVID toolkit and it just lists everything that's current. So I really try to keep that updated and things that are current and useful, valuable tools for dental teams. So check there too. But definitely always looking to your state dental association, the governor's office. And if not, you fall back on CDC and OSHA.
Well, thank you. And Jill, I can't thank you enough. I think that during this whole thing, I did so many webinars and there were so many people that didn't know what to do, the health one. So I think having those clear guidelines is such a big help. So you really gave us a lot of good information. Again, guys, please make sure if your office is not in compliant, let us help you get it in compliant. It's a lot less expensive.
It
So
is. Oh my
Jill.
gosh.
I really appreciate it.
It's my pleasure. Thanks so much. We're here for you as a resource. So, Kay, it's always good to hang out with you for an evening. I really appreciate it.
I absolutely love it. I learned so much. And you answered a lot of my questions that I had. So I appreciate that. So let me just give you a little bit of information about our upcoming webinars. So please make sure you take your cell phone. It's simple. Hold it over the QR code. And it will take you to our website. We have some really good ones coming up that I cannot wait. We've been planning it. Our committee's been planning it, and we are trying to get you the best of the best like we had with Jill. So please make sure you scan that QR code so that you can be ready for our upcoming webinars. And what we have coming up next is decode your office. You know, what's the message you're sending? And I don't know, Melissa Sproul and her team, they are amazing. I mean, she is on top of her game. So definitely please come to this webinar. It's going to be at 6:45 to 8 Eastern time on July the 4th. And then Seeing is Believing, a show, let's see, Until approach to counseling patients on complete oral health. Now, this is going to be a great one. Dr. Clark was just recently on with Dr. Blaisley, and Dr. Clark and Maria are going to come on and do a really good one on, you know, how do you approach your patients when they have oral health issues and what you should do. And it's going to be another one that's going to be fantastic. It's going to be on July the 28th from 6:45 to 8 Eastern time. So please make sure you sign up for that one. And then radiology, the radiology course is a requirement for me and my license. I don't know if it is for you and your license, but this one's we have 15 seats left. It's going to be on July the 16th from 1 to 3. So if you're looking for a radiology course, please make sure you go to shop.benco.com. And again, you'll see the item number. If you type in that item number 5750-841, that will bring you right to this site where you can get signed up for that. It's $49 a person. And again, there's only 15 seats left. And then Jill, why don't you tell me a little bit about this workshop?
I do want to say, Tia Hunter, awesome personality.
Yeah,
oh my God, 15 seats left. She's amazing. So you definitely want to hear Tia speak. She's great. Well, this one is going to have a little twist from the Yellow Brick Road, and we're going to have little excerpts from The Wizard of Oz, and I'm going to dance you through to know inspections and audits and fines. Oh, what do you do? So we'll go more in depth, and we'll talk about what inspectors are going to look for from an OSHA standpoint, COVID, and then also HIPAA. I didn't spend as much time on HIPAA this evening, but we definitely will at this one, 2 hours. So it's going to be definitely packed with some goodies. Definitely.
Yeah, and we definitely got to get you more involved because we limit the number that signs up for this. So you definitely need to go ahead and save your seat. I'll also be hosting Jill on this one, and we'll definitely want more of your input. We may even use some breakout rooms. So we have all kind of exciting things coming your way. So you can actually sign up for this one at shop.benco.com. And the item number is 5826-591. So all you got to do is go to shop.benco.com, put that number in, and it will get you signed up. Again, this is going to be a 2-hour course. So have someone in your office, please sign up for this, or the entire office, because I definitely think you're going to learn a lot.
It will be fun, really fun. Who doesn't like The Wizard of Oz, right?
You know what, Jill? I'm excited to host you. We're going to have a blast. I can already feel it. So
it's going to be pretty funny.
You can always contact your friendly Benco rep. But guys, this is something, again, it's a requirement. You definitely want to stay on top of your game. So please make sure you get signed up for this one, $49 a person. And it's going to be on August the 6th, which is a Friday. And it's going to be from 1 to 3 Eastern time. So we tried to make sure that we could cover, all of the regions. So please, again, sign up for that one. Jill, thank you. This is going to be great.
My pleasure. Thank you for the opportunity. You do such a good job with these, Kay. I love being on webinar with you. You always make it super great.
Yeah. And so again, guys, we want to thank you. You should be receiving your CE, within 4 weeks. I know Maria tries to get those out as quick as possible. If for any reason you don't receive it, please let us know. You can email us at practicecoaching@benco.com. Again, that's practicecoaching@benco.com. Also, make sure you fill out those surveys. It means a lot to our team that we really give the webinars that you want. We're trying to do 2 a month, and we really want to make sure that we're providing you with what you need to feel safe in your office and manage your offices successfully. So with that being said, again, Jill, thank you. Alyssa, thank you for all your help tonight, and we will see you next time. Everybody have a good evening. Bye-bye.